CEO Live Talks.
I am Dr. Swanee Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change, and these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon. Welcome to CEO Live Talks with Dr. Swanee Jett. And today, I have a good friend, Ms. Owsley, coming on to the set. How you doing,
Good
lady?
morning.
Good morning. Good morning. I'm so glad you come on the show. By the way, before I start, I love your shoes.
Thank you.
So you thought about it.
Yes, always.
Color coordinated. So as we customarily do, we go into your history, your background, where you grow up at, family, etc.
Yeah.
So tell us a little bit about yourselves.
So I grew up in Lexington, Kentucky, and I am one of six.
One
The
of
oldest
six.
girl, so you know all the rumors around oldest girls
Oh,
being
yeah.
the leaders of the family.
Oh,
I have
yeah.
an older brother, and I'm the second oldest girl.
But you told the brother what to do.
Sometimes.
Okay. All right.
So yeah, I grew up in Lexington.
What part of
and
Lexington?
North side of
Okay.
Lexington, and
I don't know what the north side is.
yeah.
Is that Nicholsville? Where's that?
No, that's right off of New Circle Road. I went to Bryan
Oh,
Station
yeah.
High School.
Close by the airport. Airport close.
You do not know Lexington.
I
Not
do
near
not know.
any of that.
That's
no.
right. That's right.
But I grew up like many Black families, where the village was part of my family.
Mhm.
So I was raised by my aunt that is like a mother, and my grandmother, and moms, and all kinds of beautiful women in my
Okay.
family that played an instrumental part of my upbringing.
Okay. So
Yeah.
you grew up around a lot of women.
Yeah.
So what are some of the nuggets that they gave to you growing
You know,
up?
I think strong women, of course, they raise strong women
Go
in
ahead.
many ways.
Right.
And I think I was raised with a lot of integrity, a lot of hard work, a ton of compassion and care, and most importantly, love. And I'm definitely driven by faith
Okay.
always.
All right.
So,
And so, with that being said, father role.
So my father was not a part of my life as a child, and actually he died when I was in college. So
Okay.
yeah,
And what about uncles and?
some men, but not as much of not as I guess significant roles in my life as the women played.
You know, the reason I asked that question is because sometimes, like, when I talk to a lot of women, they say, well, the first man I was in love with was my father.
Yeah,
And a lot of women end up marrying men that's similar to their father.
yeah, I can see that. Yeah.
Because that was their first love, so they kind of figured that out that way.
Yeah. No, building a family was important to me.
Okay.
And what that family looked like, I knew that I had an opportunity to decide what that future looked like. So if anything, being raised in my family environment and with the village that surrounded me was you can choose what your life looks like, and you can navigate what that future looks like. So you get a chance to decide what your new family looks like and what your future looks like and who you bring into it. So I guess I have felt more empowered to create the family that I want, not necessarily looking back on what I had or what I didn't have, but trying to decide what I wanted my family to look like and what steps we need to take to make that happen. And, oftentimes people will tell you that the most important person that you bring into your life is the person that you marry and the person that you have children with. So I took my time. I got married at 32, had my first child at 34, and my second child at 36.
So you wasn't worried, because some women worry about that biological clock, and I gotta hurry up and get married at 30, and I gotta have kids, and you end up selecting the wrong person.
Yeah, I was more worried about God sending the right person for me.
Say that again.
God sending the right person for me. So I took my time, and really took my time to develop myself and to decide who Tawanda was before marriage, and who I wanted to be professionally, and what was important to me professionally. And marriage came, and it came at the right time, and my family came at the right time. But I wanted to be married, but that wasn't my primary focus, I guess. Yeah.
Well, you have to be focused on marrying the right person.
Yeah, at the right time.
At the right time, because you might have met the right person before,
Yeah,
but it wasn't the
sure.
right time.
Yeah.
So, what high school did you go to?
Bryan Station High School in Lexington,
I
Kentucky.
do know the high school.
I think it's still funny that people ask you, what high school did you go to?
Yeah.
Like, it's like such a Kentucky thing.
It is a Kentucky thing because people want to know. Like, they don't even care what college you went to.
Well, I went to the University of Louisville, just for clarification.
There's some people that want to know that part. So did you play any sports or anything?
I did not.
Okay.
But I did pledge Delta Sigma Theta Sorority Incorporated.
I understand. Yeah. Roo. So, what did you go to study?
So my degree, I was a double major in marketing and management at the College of Business at the University of Louisville. And then I went on to get my master's at Spalding University in business communication.
But you have almost come full circle because you're caring about people. So I'm assuming your background with the family. Why choose this profession? Because it's, I mean, I appreciate it, but why?
So my career span has been in philanthropy and in nonprofit leadership, and I started my career in philanthropy, and I'll say, philanthropy looks so different in different families. So we're taught at a really young age to give, and to care about other people, especially in Black families. I think that we spend a lot of time caring, and we spend a lot of time in that caregiver space. So I did watch that growing up, and philanthropy looked really different. But it was giving, right? It was like charitable giving was important. So I started my career in that space of philanthropy being like the root of how you serve and caring about community and the role that community plays and who I am as part of that community, and what role I can play. So I ended, or now I'm currently at Hospice Health and leading philanthropy and marketing there. It wasn't just about being at hospice. It was more about the role that what the community needs, and what are the community needs, and how I can play a part in that. So throughout my career, I've chosen jobs and careers and missions and organizations that the mission aligns with me. So we know that equity in healthcare has always been a challenge, and what equity looks like at the beginning of life, the inequitable way that healthcare sometimes is delivered at the beginning of life, sometimes is also equity issues at the end of life too. So for me, I wanted to be able to support our community in an important way, and raising funds for hospice and elevating the mission and bring attention to the mission just has been something that I felt strongly about, and I think everyone deserves to have a good end of life. And if I can help with that, that's kind of how I landed here.
Hello, everybody, and welcome to Park Duval. My name is Desmond Pritchard. I'm your Chief HR Officer here at Park Duval. I'm located normally 9 times out of 10 at the Wilson location. I'm beyond honored to support our community, to work with our community. There's a lot ahead of us. We have a lot we're ready to do, we're willing to do, and we can't wait to have you on board, to have you doing it with us.
At Park Duval Community Health Centers, we go beyond medicine, breaking barriers to care across Louisville, Taylorsville, and Eminence, Kentucky. From primary care and dental to behavioral health and pharmacy support, we serve thousands, many facing financial hardship. With 7 locations and a bilingual staff, we welcome everyone because PDCHC, your health is our mission. We are Park Duval for everybody, everywhere.
So, I know we have some laws in some states that have been passed. If you have cancer, you already have a plan with a doctor say you have 2 weeks to live, and let's go ahead and end it now. What are your thoughts about that?
Well, that's illegal, obviously. That's
Some states
illegal.
it's illegal.
It's illegal.
Some,
It's, I mean,
well, they might say it's illegal, but yeah,
well, and that's not the care that we provide. Like,
yeah,
that's not what we do. That's not the mission of hospice care. Hospice care is to make those last moments of life memorable for the family and to
yeah.
take away the burden of those last moments of life. So, the last 6 months of life and serious illness, and helping you manage that end of life experience and what that looks like, and manage the pain and manage the symptoms, and relieve some of the burden for families.
And the reason I brought that up because there have been cases where you're dealing with the last stages, and I remember New York, 1970s. They used to take people to the roof. There were cancer patients and allow them to smoke marijuana to cope with the pain. I think that should come back, become legalized. I guess you do have medical to relieve some of the pain. What are your thoughts about that?
I'm not a clinician, so I'll clarify in saying
Right.
that. And, I think that medicine has come a long way.
Yes,
And there's
come
a
on, way.
lot of ways that we can manage symptoms and manage pain. And I think all of that is still being explored, and we're still trying to find
Yeah.
solutions to make sure that people at their last moments of life have, I guess, the least amount of pain as possible. But I think that we have ways to do that, and I think each family has choices.
Yeah.
Yeah.
Yeah, I think so. I was in connection with Harvard University. We was doing research on diseases and helping people to be able to navigate through that.
Oh,
I
good.
was
Good.
with as a health commissioner in Brookline. I had opportunity to oversee 5 medical marijuana places and help open them up for retail as well.
Okay.
So some of the
Okay.
cutting edge research was going in that direction
Interesting. Yeah.
to help people.
How do you think our community perceives end of life? Like, I'm just curious. Like, what are your thoughts? I mean, you are serving our community in a really strong way, and thank you for the way that you serve. Like, what do you see the barriers, particularly in the Black community, when it comes to receiving hospice care or end of life care?
You know, I don't think the equity is fully explored in the African community. Giving people options, having the financial means is a barrier. I'm gonna have to run to a hospital to see one of the sons I helped raise. He has less than 2 weeks to live because he has cancer.
Is he immobile?
hmm
Okay.
So it's a touchy situation because he's in his 30s, right? So he's living behind kids. But it's being able to provide the options and have the funding to say how you want to go out, right? How do you want to live your last days? So it's different when you're older,
Right.
right? Because you feel like I just had a friend, his mother passed away. She was in her 80s, and she says she knew her symptoms were debilitating, and she didn't have time left. She said, "I don't want any funeral. I want to be cremated, right? But I want to live in peace and have family around. And when I pass away, you have a party." So they're going to honor their wishes. They're going to do something on her birthday, which is 6 months out. So it all depends on how the family is going to deal with it. But also how the individual feels that they have achieved something in life and what the end looks like, right? Like if my life ended today, I think I've done enough. But I know I have so much more, right?
Yeah.
But I can be at peace. So it's a matter of, are you at peace or where you at? Are you at peace with God? Right? Have you fulfilled your purpose?
Yeah.
Right? And if you can live with that, right? So you're at a place that this is happening all the time,
Yeah.
right?
Yeah.
How do you deal with that?
I think I believe that everyone should have a great last moment of life, and I think I feel deeply passionate about that. And I think I want to make sure that everyone knows. I mean, you mentioned something about resources. You know, when you're dying and you're in those last moments of life, like hospice care is a benefit that you get with Medicaid and Medicare, so it's not a cost associated with that. So we take care of families regardless of their ability to pay. So, so I think that's one piece. But I also think, just in general, whatever your profession is, we all have to find times to do things that fill our cup back, or that, you know, fill our soul back. And for me, it's really taking the moments with my family, taking moments with my friends, and kind of separating myself. Because you're right, like, I do heavy work. It's a heavy mission with big goals. I mean, we're in the middle of a big project that's $13 million or $20 million. I'm trying to raise $13 million. Like, it's heavy loads and heavy stress. And I think as women, we have to find ways to center ourselves. I mean, and that might be a girls' weekend, that might be a family trip, that may be, you know, just time with friends and family at home or traveling. And I think that's what I do. So that's what kind of keeps me getting back up in the next morning.
Tune in to CEO Live Talks with Dr. Swanee Jett every Saturday at noon on Wave 3. In this thought-provoking series, we bring you conversations with influential leaders, visionaries, and changemakers who are making a difference in their communities and beyond. Don't miss an episode. Mark your calendar for Saturdays at noon on Wave 3 to watch CEO Live Talks with Dr. Swanee Jett. Together, we can shape a brighter, healthier future for all.
Let's talk about everything the hospice does,
Okay.
because you do a lot.
Okay.
Right.
Yeah. So, well, thank you for asking that question. And I hope that I'm providing education, or it's interesting. It's hard talking about yourself, and thank you for inviting me to the conversation. But, you know, hospice has been around for 45 years. We provide end-of-life care and serious illness care. We provide palliative care, which is chronic illnesses and serious illness. When we talk about end-of-life care and hospice care, it's the last 6 months of life, and we're there for families in that way. We provide the clinical care for them. We provide the social work care for them. We provide spiritual support for them. Post-death, we provide grief counseling for family members for up to 13 months past the moment of death. So our road, we serve 41 counties, so we go as far north as southern Indiana, as far south as like Bowling Green, Madisonville, and our goal is we take care of about 10,000 patients a year in our community. And for me right now, we're in the middle of building a new inpatient care center.
That's right.
That is going to be the first standalone center for those illnesses that can't be taken care of at home. So most people want to die at home, but there's about 10% of our population, they're too sick to be at home by themselves. So we want to see those patients in that space. We're going to break ground for that on September 16th, and we want the community to come out and support the breaking ground of our hospice inpatient care center. And it'll be located off of the Water Center on Breckenridge Lane, and then really easily accessible to everyone. But, you know, I think that everyone believes that hospice itself, the type of care, is it's sad, and, you know, it's kind of difficult to talk about, because it is really difficult when you think about losing someone, but it's really not. It's extremely compassionate, and it's thoughtful, and we want families to think about that differently, and we want them to think about the last moments of life differently. We prepare for birth, and we should probably prepare for death in the same way.
You know, it's one thing for an incident to happen very tragic, so you can't prepare for that. But hospice, you can prepare. How much do you focus on? Because I would think you have to have a lot of compassion. How much is that focus there?
I think that I've worked in a lot of healthcare organizations and universities and in nonprofit work for a long time. And the care providers that we have are probably the most compassionate people that you'll meet, and just thoughtful and caring, and they're exceptional in understanding what families need. And I think that is a huge part of like our mission.
And with this $20 million facility, what is everything that you're going to provide there, and how many people do you expect to be able to house?
So it'll be 21 beds,
Okay.
and it'll be for, I guess, the sickest of our patients. So those patients that need additional care and nurse care, clinicians. It'll have a family room and have an outdoor space. It'll have a family kitchen to where if you want to fix a meal while you're there for your loved ones, families can stay there. It'll fit about 8 family members in a room, so you can be with your loved one for as long as you need to be, and have a shower in the room. And all of that is mostly being funded through philanthropy. Medicaid, Medicare reimbursements take care of your care, but the rest of that is funded through philanthropy.
So, the big ugly bill is out,
Yep.
right?
Mm-hmm.
So there's been talk about cuts to Medicaid.
Yep.
Not much Medicare. Medicare, I think, is universal insurance that we probably should have for Medicaid. So how much will the cuts impact you?
I mean, we're watching it closely, probably like you are too, and trying to see. I mean, right now, we don't know. I mean, we don't know what the cuts are going to look like. I don't think anybody knows quite yet. We're anticipating there's probably going to be some cuts. I don't think it'll change the way that we deliver care, and it should not change the folks that are eligible for our care, that have access to our care. But like everybody else, we're paying close attention to it, and I'm hoping that it's not going to have a big change.
So how much of your operation is Medicaid?
So it's a
Your budget.
Medicaid, Medicare model, our reimbursement model, and the majority of the dollars that come to hospice are through Medicaid and Medicare funding.
Okay.
Yeah.
All right. So if Medicaid was totally wiped out, how many people it might impact?
Oh my gosh. I hope to God that it won't happen for us. That when we see 10,000 patients, so a large percentage of that.
Okay.
So we pray that that doesn't happen and that it is sustained. I'm hopeful.
I heard it's about 30% of the patient load might be cut through the Medicaid cuts.
Wow.
So I've been reading the
You've
bill.
been paying attention.
It's about 870 pages. It's about that tall.
Are you going to do a Cliff Note version to give to everyone once you read all
You
of
know
it?
how to decipher because there's a lot of
Yeah, use some
ambiguity.
AI.
I'm gonna tell AI,
Give me the Cliff Notes. Yeah, when you get done reading it, send it to me because I'm not going to read it.
Yeah. I must decipher through it because I need to. Maybe I'll do it one day with a scotch and a cigar just to calm my nerves.
I don't know how you're going to read it, but yeah, I would say you need to do something like that. Yeah.
So I do have a question though for you. I'm just curious. Have you personally had to deal with anybody in the last stages?
Yes.
Okay.
Yeah. I was actually with my grandmother her last moments of life, and with the rest of my family, and was holding her hand, and I think I think about what I often thought about her and how she had cancer and had colon cancer, and she decided to not do any treatment. And like I said, we have a big family, and we were all there with her, during those moments. And I just remember how spiritual that moment was, and how much having hospice there changed like that moment for our family, and how we were just able to be there for her and be family members while they were managing her pain, and the nurses and caregivers were there taking care of our family too, and it was not it was a loving homegoing, and it wasn't painful. We grieved and still grieve, but she wasn't in any pain, and she never complained throughout those last moments of life. And we were just able to I was able to be her granddaughter and just be there with her.
And the thing is, why does she not? Because I hear this often. Why does she not want any type of treatment?
She was in the last stages of her cancer diagnosis, and she was aging, and she chose not to go through that. That was her personal choice. And I think people have that choice. People have that choice to say, I mean, if anything, we want to always have control of our health care, and we want to be advocates for ourselves. And depending on who you are and where you are in life, you can make a decision that I don't want to seek treatment. And I think that's a personal decision. Yeah.
Yeah, it is. And I'm thinking she probably was at peace.
She was totally at peace. She had, she had a strong faith and was very much, and had raised kids and grandkids and great grandkids. She was good.
So I'm gonna tell you how I'm gonna go out.
What is your plan? Like, let's tell people to make their plan. Let people know what your plan is.
I have a plan.
Okay, what's your plan?
So I told my wife I'm gonna be buried in my white Cadillac
Okay.
1969, which it probably is not feasible. But if I ever have to go that route, I'm gonna have a good long cigar. I mean, that cigar gonna be about that long.
In the Cadillac.
In the Cadillac, I'm gonna sit there with some cognac, and we're gonna be there for some hours. And then I'll be like, "Yep, it's time to go."
That's how you want to go.
That's how I'm gonna go out.
Okay. Well, make sure you do some advanced directives and make sure that everybody knows.
Everybody knows, so I ain't got to put the word out. It's on film, so you have this to go back to.
Okay.
So, are there any last things you want to tell us about your work? And I'm curious too, you know, in terms of where do you see yourself going from here?
You know, I'm really happy in this space and in life in general, and just probably this has been some of the most happiest moments of my life at this stage of my life that I'm in, personally, you know, and professionally, and I'm enjoying every aspect of my life. So it's so hard because I've not had to like look for jobs that often. Oftentimes, like things have come my way, or someone has like tapped me and said, "Would you consider this opportunity? Would you pursue this opportunity?" And I've had like a really good career with folks just kind of tapping me in different ways. So I guess I'm open to growth. It would probably be another leadership role, but at this time, I'm really happy at hospice, and I mean, I hope that I'm able to grow within hospice and continue to develop. And
You're doing great work.
I
I
appreciate
have
it.
never been tapped. I am so upset.
You have. I'm shocked that you've never been tapped. Like I'm
Never been
really shocked.
Nobody have ever came up and said, "We want you." I
Oh
feel
my
like
gosh.
the Prince song. Do you want him? Or do you
Oh
want
my
me? 'Cause
God.
I've never been tapped. I
Yeah.
might never be tapped.
You
You've
may.
been so blessed.
I have been very blessed, and I'm really grateful. I've also worked really, really hard, and I've worked really hard on respect and integrity and being seen as a professional, you know, in the community. And hope that my work has spoke for itself, you
It
know.
has.
And I've had some great opportunities, and I'm really, really grateful for. And I think God's plan, right? Like I think He orders our steps, and we just kind of walk in His path.
Yeah, he told me to do some things, but I've never been tapped.
Well, maybe He was tapping you when He was telling you to do some things.
I probably should have stayed still. Maybe I would have been tapped.
I have listened, and when He said go, I've gone,
Nah,
and when He
I've
said stay
gone.
still, I've stayed still.
I have gone. So, but this concludes my show for the day. Dedicate your life to a cause or mission that will outlast you. Thank you.